Now to our ongoing CBS News investigation into fraud in the hospice industry. Our investigative unit found some potential red flags when hospice doctors submitted claims for more than 20 times the number of patients the average California doctor cares for in a year. CBS News correspondent Adam Yamaguchi hit the road to follow the money.
The state of California says that if a doctor is involved with any more than even just a few hospices, it is a sign of potential fraud. At the heart of the industry are doctors who are trusted to sign off on care. But in records for the active physicians caring for terminal patients, one stands out. A man whose name appeared on claims from 126 hospices and had 60% more in Medicare reimbursements than the next closest doctor in 2024. The last full year of available data. Dr. Rajiv Buva. My name is Adam Yamaguchi. I'm a correspondent with CBS News, and we're doing a story about hospice. And we're just trying to understand how often he's here.
I didn't see him in a long time.
In a long time. Neither had many of the hospices we visited. We wanted to find Dr. Buva to ask how he managed to work for so many different providers. So we followed a trail of hospice offices linked to his name and Medicare claims totaling $71 million in 2024 across the LA basin. We understand that Dr. Rajiv Buva is the medical director here. We're just trying to get some information about him.
He's not.
He's not?
No.
Was he at some point?
Yes, he was.
But you're telling me he no longer is associated with you guys?
No.
Was he at some point?
Thank you.
Okay. On average in California, a hospice doctor cares for about 140 patients in a year. In 2024, claims with Buva's name were submitted for nearly 2,800 terminally ill patients.
There's no reason to think that that's legitimate.
Dr. Christina Newport has been in the hospice field for 18 years. There are a range of reasons why one physician might be identified in connection with the care of so many patients, including stolen identity.
If someone is really effectively evaluating the plan of care for every patient that they admit to the hospice, which is their job and their responsibility, they, would have a superhuman schedule to do that in a meaningful way.
CBS News found Buva's name tied to several hospices that lost their Medicare certification for what regulators called an abusive billing, a pattern of submitting improper claims. We reached out to him on the phone and email, but couldn't connect with him. So we headed to Dr. Buva's home address. Dr. Buva came out. He said that being affiliated with dozens of hospices is not illegal, right? And I said, you're correct. There's nothing in the law that prevents someone from being affiliated with many. But again, it raises flags, and that's what I have questions about. Buva said he wanted to see our information. Until then, he said he wouldn't talk any further. So we came back with the data. Hi, Dr. Buva. This is Adam Yamaguchi again with CBS News. We were able to hear you through the door. He's made his decision not to talk. Now, we tried multiple ways and times to get in touch with Dr. Buva. The first time we spoke with him without cameras, he asked us to come back with documents. And when we did, he wouldn't answer the door. We'd still like to talk to him.
It's a really important investigation, raising these questions about fraud.
Absolutely. One of the things that's so shocking about all of this is that this appears to be hiding in plain sight. When you look at those numbers, the 126 hospices and the nearly 2,800 patients in 1 year, we're the only ones asking these questions.
Oh. Something tells me, Adam, more people will be asking questions after that story today. I love how you went back and said, we're here with the data, and we can hear you inside your house. Let's see if he gets in touch with you.
I think the question that many people have is, why is my health care so expensive? And is it because of all this fraud that exists out there?
Absolutely. Ultimately, we, the taxpayers, end up paying.
All right, Adam.
Thank you.